Good evening. The news gang is here. The hand washing is still on. The social distance still distant. The daily press conferences have not stopped. But are they all masking the big picture, or is everything happening in isolation? We'll ask if the government strategy is too sanitized or whether it meets the case definition of a winning formula. Also on the show tonight, Corona may have stopped the reggae, but why are Jubilee wrangles going this viral? On the memo tonight, Jamila pays tribute to a fallen giant. Yvonne is calling for prayers for Kenyans abroad. Gashuri's punchline is betting on a Corona gate in the end, while Kaikai's kicker digs out unusual lessons from COVID-19 that may never be learned. And on my angle tonight, I am because we are. Let's start the show. Ladies and gentlemen, 1 month later, actually the president said 1 month and 3 days.
Yeah, 3, yeah.
All right. Yvonne, 234 cases so far, 100 actually, and something recoveries.
Yeah,
53 today.
53 recoveries,
today,
11 deaths.
Today, 11 deaths.
Yes, I think it's 236 total cases, 9 new today. A curfew countrywide, 4 counties remaining isolated. The infection spreading over half of the counties. Social gatherings banned. Schools, churches, bars and restaurants closed. Those who are over 58 are staying at home. Those infected ranging between the ages of 2 to 64. 1 month later, and our lives have totally changed. What I find interesting, you know, at this point is, and maybe frustrating on a personal level, is this drip of numbers. You know, it's 9 today, 6 tomorrow, 12, 10, and it just seems like we're sort of stuck in a rut. And that's not to say that I'm hoping we will get to those 5,000 or 10,000 numbers that were projected by the Ministry of Health. But, you know, it's just getting to the point where it's redundant. And you know this, when we sit in the newsroom, we can almost say word for word what either, you know, Dr. Mangangi or Mutahi is going to say.
Hours, we have
in the last
received
24
confirmation.
hours, we have tested 700 samples. Out of those, 9 have tested positive. It is sad to say one person has, but you see, now we're changing it, because now we start with.
But I mean, the health workers would say that they'd rather a situation like that than a case where they get like 300 new cases all at once.
But let me just say what I find interesting. I don't know if I can call it worrying, but this is interesting. If you compare Kenya and Ghana, we actually reported our first cases on the exact same day. That's the 13th of March. And Ghana has tested over 44,000 people so far. At the start of April, these are some of the measures they put in place. A 50% salary increase for frontline health workers. And yes, I said increase. No taxes for the next 3 months. Free water supply for all citizens. They have a lockdown in a number of their regions. At the start of this, that was in March, they had set aside $100 million US. And they now have over 600 cases. If you contrast that with Kenya, we've tested now, the president says today, slightly over 10,000. You know, our numbers are at 200. For sure, I think what the situation will be in the end with those 100,000 or whatever that's projected is that there will be many that will not have been tested and who will still contract the disease. There will be many deaths, all of which officially on record will not be attributable to COVID-19. But I think that's where it'll be. For me, it's just the testing that needs to be ramped up like yesterday. Otherwise, we're flying blind.
Jamila, what have you seen? What has it been like for you?
Other than the effects, and I'll talk about that later, but for me, I'm just glad that the predictions that we had been given of about 1,000 by mid-April and then 2,000 people by the end of the month being infected.
Just 5,000.
Just 5,000
and then 10,000 at the end of April.
And we are not seeing that yet, which we are really, really grateful. A number like 234 is way, way below what we had been told. And of course, the measures are being put in place, despite the president warning us today that people need to follow instructions and that have been put about not gathering in large groups, which we have seen people doing kichini. We've had people being arrested because of meeting and holding parties, kule mitani, and of course the washing of hands and the masks everywhere you pass now. Kila mtu anavaa mask. Of course, unaogopa kuwa fine 20,000 shillings or jail for 6 months. This is really, really good for me, seeing that 234 cases instead of the 5,000 or 10,000 that had been projected earlier. Also comparing it with what's happening in other countries across the world, where you hear 2,000 people have died in a day. But on the other side is how life has changed in the past 1 month for everybody in this country because of the amri ya kutotoka nje usiku from 7 p.m. to 5 a.m., not being able to move across counties unless you have special permits for maybe those with essential services. You really have to get out. But it's just how we do normal things that we used to. For instance, the burials. We'll talk about what happened in Siaya, or the weddings. We talk about the family that the couple that got married in Thika, and the groom's family could only follow on Facebook because they could not travel, despite them having planned that they'll go a large group for the wedding of one of their children. So these things are really changing slowly, but life is going on. People are getting married. People are getting buried. We are sort of somehow trying to work with what we have. It's very difficult, and we all hope and pray that very soon it ends, because we have children at home who are not sure whether they'll do exams or not. We have children at home who are not sure what's going to happen in the next few months. There are those who had psyched themselves, mwaka huu nitamaliza mtihani, but keep thinking another year maybe in school. So there are all these things going through our minds. But for me, I'm just grateful that the number is 234 and not 5,000 or 10,000 that had been predicted.
Linus, thancfully, you still fall within Nairobi metropolitan area, but
it was really close.
Yes, I know. I know where the roadblock is. I won't say it on TV.
I'm hoping for a review.
but this is literally the only thing we've talked about for the last 1 month plus, and there's no single day that you will not see a government official, sometimes 2 of them, sometimes 3 of them, talking about coronavirus. Are we getting it from what you can see?
I think it has been a major test for government departments. And one department that should actually celebrate coronavirus is the Ministry of Health. Before coronavirus, Ministry of Health was a synonym for scandals. We knew it for the medical equipment leasing scandal. We knew the Ministry of Health for the mobile clinics scandal. About everything that has gone financially wrong in this country, some of it always ended up in the Ministry of Health. You look at former Auditor General Mr. Edward Ouko's reports, Ministry of Health was the star. But here tonight, a month down into this coronavirus crisis, we have a Ministry of Health that is projecting a different image. The real sanitization is happening at the Ministry of Health. Because in the Ministry of Health now, we've seen a rare combination of good leadership. And this must be stated. There is that English saying that says, cometh the hour, cometh the man. And the man that came here is Mutahi Kagwe. And his first assignment happens to be coronavirus. But below him also is a very competent team, a team that has showcased ability on television. You're talking about CAS Dr. Mercy Mwangangi, who is actually, in a way, acquitting or cleaning the name of CAS, which is a position that not many Kenyans understand the meaning of. Because these positions were created largely to make political accommodations than to improve efficiencies in ministries. But here is competence, here is ability in the form of...
In a sense, they should carve a new title for her, because of just how tainted the whole CAS
the
thing
CAS is so tainted that it shouldn't belong to Mercy Mwangangi. And we shouldn't forget Rashid Aman, Dr. Rashid Aman.
Yeah.
He was the first face from the ministry before Mutahi Kagwe was confirmed.
Yes. Yeah.
It was CAS Rashid Aman, who in that very World Health Organization composure, spoke about COVID-19. So this, and I don't want to forget Director General Dr. Patrick Amoth. And also we do have Colonel Cyrus Oguna, whose role as spokesman just got enhanced because of this coronavirus crisis. Joe, just in terms of the question you're asking with projection of leadership in government, crisis produces leaders. It's crisis communication that demonstrates your ability in terms of leadership. And I remember in the sunrise of our journalistic career, we heard of Salome Tadessa, who was a spokesperson of the Ethiopian government during the Ethiopia-Eritrea war. You listen to her in media interviews, and you know, the position of government was projected very, very well. This ability to project a position is so important, because the list of leaders at the Ministry of Health, for example, will change nothing about coronavirus in terms of there is no vaccine. They can't give us a vaccine, but they'll give us words, they'll demonstrate a demeanor that is assuring. We don't have enough
ventilators, we don't have enough ICU beds.
And we don't have enough ICU beds. In fact, we are in trouble. But somehow, in the way they are communicating, we see a lot of hope. Now, that is leadership, Joe.
Oh, wow. Francis?
Yeah, very many things have happened. We've had to adjust, all of us.
I'm hoping you will tell us about Parliament, but...
Yeah.
Sorry for
Many things have happened. We have to adjust, all of us, individually and collectively. But what I also find interesting is, to take it from where Lina's left it, there's some good leadership in the Ministry of Health. I'm one of those people who would not want to imagine how the situation would have been if Mutahi Kagwe's predecessors, without mentioning names whatsoever, were still in that office.
Actually, better put, if any other ministry handled that.
let me talk about predecessors.
I will not mention names.
Yeah, without mentioning names. It would have been terrible, because here is a situation that one
even
requires...
if you were to go all the way back to independence.
Yeah, please go up there. This is a situation that requires composure. This is a situation that requires some tough love once in a while. This is also a situation that requires honesty, like this is what is happening. Sometimes you need to be a bit tough, and we've seen Mutahi sometimes tough. In fact, there was a joke in the newsroom the other day that alitusomea mpaka sisi wote tukainama hivi kwa newsroom, because he's talking to you personally. So it shows this good leadership. And as I said last week, luckily, he doesn't keep telling us about His Excellency the President. He is owning the process, which is a good thing. Number two, I was expecting that by now, a few more things would have been told in terms of state of preparedness, how are our counties ready to deal with the situation, if they are not. The numbers and the statistics story is now pretty predictable. Maybe now we need to move a little bit more and explain to people in details what is the state of our preparedness. Where can people get assistance? What kind of assistance is available? And today, at least, I saw the president talk about the welfare of the frontline workers, the health workers. That is something that was also a big concern, because when you hear health workers complaining about their personal safety, and they're expected to take care of us all in the event that we fall sick, then there was a concern on that line. And now that you talked about Parliament, well, there was a good session in Parliament. I hope many of our viewers followed. And I hope that members of Parliament can be persistent in it and say the right things at this time in relation to the COVID-19 pandemic fight. But also tough times for parliamentarians. About 50 of them were there. And somebody was joking that maybe this is a confirmation that probably we don't need all these many members of Parliament. It should be about quality rather than quantity.
Oh, wow. If you look at how this thing has moved around the world, different countries are taking different approaches to it. There are countries where they've shut down everything. There are countries that are taking it one step at a time. There are countries like the US where there's a whole argument what they should shut down, whether they should reopen the economy. Let's just talk a little bit about what we have done here, Yvonne, in terms of locking down certain things, if you can call it that, restriction of movement, shutting down schools, and all of these things. Do you see a strategy in all of this?
What I see is a government that's trying very hard to still keep the country running, but at the same time fight, a pandemic, what will be an epidemic, hopefully not, if we put all the measures in place. You see, everybody keeps talking about, let's lock down the country, let's do it once and for all and get it. But it's not as easy as some may think. Yes, it is important to prevent as many deaths as possible and to prevent hospitals being overwhelmed with those numbers, because then you'll still have these people to continue to build the economy. When I was speaking to Mohamed Belia a few weeks ago on the show, he said the biggest stimulus plan for us is to fight the disease. Once we fight that, then we can quickly get over this and move to the next one. Kwame Owino as well, this morning on Daybreak, spoke to Trevor, and he talked about, just the dicey situation, because you have taxes that have been reduced in the name of VAT, or at least proposals. We'll see what Parliament does about it, from VAT to corporate tax to payee. But then that means that there's reduced income for the government, which is, their revenue, considering things were not as good. I mean, I think in the month of March, we had, a serious deficit. So you have them trying to make things a little easier for people who, by the way, are staying home and not generating as much revenue. And at the same time, the government desperately needs these funds, not just to fight COVID, but to continue, with other operations.
Actually, today, the CS National Treasury last week was saying the government is going to lose 173 billion shillings this year, 2020.
Yes,
and remember,
this financial year to June, right?
To June, but also to the end of the year, 173 billion or thereabout. And remember, we were still not collecting enough. So it's a problem compounded.
Right. And we might still need to borrow to just, plug this gap. And considering we're in
some of the MPs were raising those very questions about some of those measures that have been taken. Well, you know what? I mean, we are going to have a problem with the budgets now, because this is a time when the government really needs money. That there would have been other ways of doing this, other than through the reduction of income tax and VAT and that sort of thing.
Yeah, we will get to see, I suppose, what alternatives Parliament can come up with. And I think this is why we've been asking for Parliament to reconvene, which is, do they agree with the reduction of VAT, or, should this not be done at this time? I think those are some of the interesting things that we wait to see. But again, it is not an easy decision. It is not an easy place for any government to just simply say, oh, you know what, let's lock down the country. There's a lot more at play. And considering the fact that the entire world is also battling the same thing, so we're finding ourselves in a very lonely place, because who will we run to for help now?
I think for me, Yvonne has spoken about where will we run to. I would like to see all our 47 governors come out and tell us their state of preparedness in each and every county. We have seen some governors come out much more like wametoka mbele kabisa, wameendelea, like in Mombasa, Governor Joe is doing a good job. We are seeing in Makueni there's a whole COVID center hospital. We are seeing in Kitui what the governor is doing with the masks there. We are seeing a few other governors here and there, but not all of them. There are some who are really, really, really quiet, and we'd like to know what is going on in your counties. What are your strategies? What are your plans in case this disease does make its way into your small county or whatever corner you are? Because we keep saying that this disease, it's easy for it to transfer. Mtu akikohoa and it transfers, and that's it. Umepata, you travel in a matatu or in a vehicle, you greet someone. Okay, we've been told not to salimiana, but Africans ni ngumu sana, bado watu wanasalimiana. But what I'm trying to say, it's easy for this virus to transfer from one person to another. So we need to know, how prepared are you?
But you see, I think one of the things that I suppose is going to happen with the mass testing, and perhaps should, is for us to know the extent of the spread, to know where this virus really is. I mean, if you're in a county where it really isn't there, then perhaps there should be a way to protect those counties from the other counties that have it, so that if indeed there are things that can continue in that county, let them continue, so that at least there are certain parts of the economy that are moving. Because, I mean, it's no point putting the whole country in the same state, while in fact it might be that the 21 counties that we've talked about that actually have this problem. Remember also that the 21 may not exactly be 21, because there are people that have been saying, oh, this person is called Onyango, and therefore they were born in Migori or whatever, and therefore this is a case from Migori, yet this person perhaps has never actually been to Migori. So there might be some reconciliation that may need to be done with regard to where these people came from and where they actually live now. Because right now, I mean, my county counties here, but I don't have any effect whatsoever about what's happening there because I don't live there. Most of the time I'm not there. So that's a situation that might be happening with a lot of those. But there might be need for us to really figure out where this thing is so that we don't burden some of the counties that have no cases with restrictions that they could do without. Linus, before we take a break.
I just wanted to make the second point of what I think stood out in the month, and before I do that, I actually think the administrative structures really favor the country right now in terms of a response to a crisis like this, because remember that every county now has a Ministry of Health, sort of, which in a way means there's some structure of a response mechanism that can help on the ground. But going to the second issue that really stood out this month, it's not just about government. There was a lot that is expected. There was and there is a lot that is expected of the general population when it comes to combating COVID-19, and that is behavior change. And it's very sad to see the usual peculiar Kenyan habits coming in the way of this fight. Last weekend, we watched adults being arrested from an estate. They were partying. We've also seen reports of others using ambulances to attend parties.
It's ridiculous.
Look at that. You know, not even Italy went to this extent of recklessness. This is really seriously reckless, which is why sometimes when you have the ministry becoming harsh on the quarantine time, it's because of some of these difficult behavioral issues. I was very disappointed watching that, Yvonne, when you see people completely participating in parties.
And leaders, some of them. I mean, others, I think other estates, it was actually the leader of the estate group. I think who was having a party at his house. Was it a birthday party and an Easter party?
Yeah, which is why,
funny, it's a must. What is wrong with people?
Which is why in the first show, I think first show of the corona situation, when the police did these terrible beatings, you look at some of these people and say, do they deserve less? Because a lot of innocent people are beaten on the first day of curfew.
That's right.
Now you get these chaps, and you know they'll go through the usual process, 14 days of quarantine, and then bond. You know, I think they deserve tougher measures than that.
All right. We need to take a break. Then when we come back, we can actually look at what's happening here and even what's happening to Kenyans who are actually not here.
Yeah, that's right.
Let's take that break. We'll be right back.